government regulation. It is not a new entitlement program. It's an empowerment program. It's a shift away from the old, please the bureaucrat regulatory paradigm. And it's a new, please the customer, market-based regulatory approach. It enables essentially every American to be able to shop for health insurance and health care. That may sound commonplace and unremarkable, but when you think about it, we've never really been allowed to shop for health care in America. Because in order to really shop, what do you have to know? You have to know the price and the quality in advance so that you can comparison shop. Well, what's the price of health care? We usually don't know. There are not many doctor's offices that have a price list posted in the waiting room. And it's not because we already know the answer. The Wall Street Journal did a survey asking us what an annual physical cost. And Americans guessed everything from $8 to $2,500. And were willing to pay anything in between, especially when we were spending other people's money. Price is a very important issue because today's healthcare system is full of many, many good people caught in a rotten incentive structure. Today's healthcare system is primarily designed to make more money off of us the sicker we are and the more tests that are run. That's a pretty rotten structure of incentives. Under a new and better approach, we think there should still be plenty of incentive to make money, but primarily by keeping us healthy and doing the right number of tests. As important as price is, what's even more important? Quality. Because we all want the best for ourselves and our loved ones. And you know, on the quality measures, we're almost as in the dark as we are on price. The average American knows more about the statistical behavior of professional baseball players than we do about the doctors or hospitals who are operating on us. There's an exciting new field called outcomes reporting, outcomes research, that enables us to measure quality and to reward quality in a way that's fair to our medical and healthcare professionals and disclosable to the public so that the people of this great country can decide where the quality is and how to get it. You know, the quality revolution was a little bit slow coming to American business. The great Edward Deming, an American, was honored in Japan before he was honored in this country. But the quality revolution still has a ways to go in terms of American medical finance. We need to keep this in perspective because overall we do have the highest quality medical system in the world in this great country. None of us would seek treatment in another land. They're all trying to come to this country for treatment. So we should be proud of our high overall level of quality. But we do not have the best infant mortality rate in the world. We do not have the best longevity rate in the world. In so many ways, we are simply not getting our money's worth from today's system. Quality measures that are fair to providers and disclosable to the public will help us solve those problems. With quality, we don't want the system. You may have heard about the veterinarian whose side hobby was taxidermy, and his slogan was, "Either way, you get your dog back." That's not quality-based management. We like the idea of annual menu-based shopping for health coverage, similar to the system that federal employees have been enjoying for 30 years now. Instead of Congress keeping a benefit system for itself and its employees, it's high time that we shared that system with the whole country. If done properly, this could enhance consumer choice, promote higher medical quality, and contain costs at the same time. In fact, we think that managed competition will be tougher on costs than any other approach, especially tougher than bureaucratic price controls. Because when you hire a lot of bureaucrats, that doesn't lower prices, that raises prices. We support the health insurance reforms that you find really in several of the plans, but also in the White House plan. They're in the Clinton plan and they're in the Chafee plan. We make sure that every American can get good health insurance at low group rates, as if you work for the biggest company in town. No insurance company could turn you down anymore. And people will be able to keep that coverage no matter what happens to them, no matter where they work, no matter whether they work, no matter how sick they are or have been. This coverage will stay with you if you get sick, switch jobs, or are unemployed. In healthcare jargon, we are for guaranteed issue insurance with a ban on pre-existing condition limitations and experience rating. In other words, no more canceled policies, no more price gouging, no more insurance company discrimination. We not only make insurance available, we make it affordable. Every American under twice the poverty level would qualify for help from a program that would replace today's Medicaid program. That means 4 times more people would be covered under this new program. We need to realize, folks, we're paying their bills anyway. We might as well go ahead and manage the problem. Little attention has been paid to the fact that under our plan, under the Cooper bill, every taxpayer would finally benefit from a new tax deduction for the low-cost basic plan in their area. Today, only corporations can fully deduct. Even the self-employed are denied their fair deduction, and the employee usually gets nothing. Well, the Clinton bill would enable not only the corporation but the self-employed person to deduct. We would enable the average American to deduct the low-cost basic plan. Our intention is to help every American at least afford Chevrolet coverage before we subsidize anyone's Cadillac. Now, if you want a Cadillac, fine, this is a free country. You could still deduct most of it, the Chevrolet portion, but the leather seats, the sunroof, would need to be paid for with after-tax dollars. This alone is a new $54 billion middle-class tax benefit over the next 5 years, and it would be paid for by trimming a corporate tax break. As you've seen from this week's endorsements of our plan, that's a corporate tax break that most corporations understand the need to trim. I'm proud of the fact that our bill has been supported by groups like the National Federation of Independent Business, a small business group, and that the Business Roundtable, a group of large businesses, also like our approach, and the Chamber of Commerce of the United States is not very far away. So we think this is a much needed change in the corporate tax law. We feel that these reforms taken together, user-friendly insurance, and this new help for the poor and near poor and the middle class, should remove all obstacles to Americans getting health insurance. There's no reason why everyone could not be covered with these reforms. If there are some, we will very soon know who they are, and we'll be able to figure out a way to cover them effectively on the President's timetable, which we need to remember is 1998. This is the so-called universal coverage issue. This is what the President was talking about when he said in the State of the Union message, "Hear me clearly. If you do not pass a bill that guarantees every American private health insurance that can never be taken away, then," he said, he would veto the bill. The President meant by 1998, because that's what's in his bill. We think we can achieve his goal on his timetable. We just do not think that the employer mandate is a good way to do it. That's a tax on jobs. And you need to remember that 30% of the uninsured have no contact with an employer, so the employer mandate won't even complete the job. When you look overall at the broad range of health care issues, when you study these long and complicated bills, you'll discover something that may surprise you. That my bill, for all the press attention that it's received, is the closest bill in Congress to the President's bill. There are some significant differences, and we need a vigorous national debate on those issues. They boil down to this, primarily: the role that government should play in reform. Generally speaking, the White House bill favors a big government approach. Our bill tries to keep government to an absolute minimum. We disagree with the White House, as I said, on the employer mandate issue. That's a tax on jobs, and we need more jobs in America, not fewer. We disagree with the White House on the bureaucratic price control issue, as I mentioned earlier. Bureaucrats don't lower prices. They usually raise prices. We disagree on the Health Alliance issue. They should not be large and regulatory. We think they should be small and genuine cooperatives run by the people, no more threatening than a chamber of commerce. We disagree with politicization of the basic benefits package. Many of my colleagues are very able, but very few, if any, are really qualified to put together a medical or health basic benefits package. It could turn into a field day for special interests. We think you should turn it over to health professionals and have Congress vote yes or no on the whole package without amendment. So, now, last issue is a little more complicated. I think you need to be careful on the issue of state flexibility. I mentioned earlier that we need a flexible reform approach. But we disagree with the section in the Clinton bill that would allow any state to choose the Canadian option, the single-payer option. Nobody ran for president promising Canada. We shouldn't end up getting it. You know, when you're sick or injured, you don't really care about an invisible county line or state line. All you care about is quality, affordable care and getting to it in a hurry. We think now is the chance of a lifetime to have a seamless approach for our nation so that wherever you live, wherever you work, wherever you want to live or work, you'll know that you've got access to quality care at affordable prices and don't have to worry about that invisible state or county line. Our bill does promise a lot less than the President's bill, but we're confident that we can deliver on every one of our promises. The administration bill contains at least 4 brand new entitlement programs, some of which may be excellent ideas, but they are paid for by slowing the rate of growth, what some people call cutting Medicare by $124 billion over the next 5 years. Will seniors accept that trade? I don't know. I don't know anyone who knows. To conclude, our bill is closer both to the President's approach and to the Governor's approach than any other bill in Congress. Ours is and has been for years now the only bipartisan approach. It is certainly far from perfect. When Mike Andrews, Charlie Stenholm, and I got together on this several years ago, we were just relatively junior congressmen trying to do our jobs. We think our bill is the best starting point if you want to achieve national consensus on this tough issue. Democrats, Republicans, independents, and folks who don't care a thing about politics, even despite your fine efforts, need to feel comfortable with the new system. I feel that with managed competition, we'll come up with a system that doesn't require us to copy the medical system of any other country on earth, and they've all chosen government takeover, as you know. But a system that's so much better, it should enable us to beat other nations, beat them all to pieces, and have us once again be the envy of the world. Thank you very much. Thanks again for the opportunity to be with you. I don't know if there's time for a few questions and comments. I spoke a little longer than I intended. If there are some, I would be delighted to try to field them. Yes, ma'am.
Summer Hayes, for the state chair from Oregon. I would like to know how your plan